Good afternoon. Today I would like to discuss an article titled Improving Medication Adherence by Using Practitioner Nonverbal Techniques, a field experiment on the effects of touch. This article was published in 2010 by Professor Nicholas Guggen and colleagues. Nicholas Guggen was born in November of 1964, and he has a PhD in psychology, human behavior, and communication. He currently works at the University of Berthenod-Sud in France since 2007, and he is the lead professor of social behavior and communication courses there. He's published many articles discussing human behaviors and the responses to different forms of communication, whether it be verbal, nonverbal. So first, I'd like to discuss the problem in this article. Per Professor Guggen, he'd like to evaluate the effectiveness of tactile touch on medication adherence versus no tactile touch. And he also hypothesizes that practitioners who use tactile touch of 1 to 2 seconds towards a patient would be consistent with greater adherence to prescribed medications. So now let's discuss why this is important to healthcare providers. Professor Guggen had statistics saying about 70% of patients are non-compliant with their prescribed medications. And this can be a big problem for practitioners and health insurance companies. For instance, increased hospital visits, increased urgent care visits, the development and the progression of drug-resistant organisms, and increased healthcare costs. So how did he conduct this experiment? Let's look at his research. He selected 6 practitioners over a 5-month period back in 2007 who would get the consent from their patients, and he used patients ages 20 to 30 years old because they seem to have the highest incidence of medication noncompliance. And he used one designated diagnosis, which would be bacterial pharyngitis, which requires usually a 7-day course of penicillin where you take the pills twice a day. He also had a rehearsed phrase that practitioners would use when prescribing the medication to each patient, but the difference would be he would randomly have the practitioners touch the patient on the arm for 1 to 2 seconds when citing this phrase to use the prescription that they are recommending, and then other patients would not be touched. And each of these encounters would be documented. In order to follow up with the study, he had home visits to each of the patients who decided to participate in this, so they could have somebody go out and physically view the medication bottle or box and document the findings. So now let's talk about what the researchers found. So overall, there was an increased compliance with medication adherence with the touched patients. Professor Nugent cites tactile contact by a prescribing practitioner towards the patient showed greater compliance with prescribed medication than patients that did not receive tactile contact when practitioners prescribed medication. So this goes to show that his hypothesis was correct, that tactile touch does improve med compliance. Finally, this documentation and statistics would encourage practitioners to use tactile touch when prescribing medications to increase patient adherence to their medication regimen. He's also published a few other articles relating to tactile touch with the result of positive behavior from the receiving party. One in particular that was published in 2010 called The Effects of Women Incidental Tactile Contact on Men's Later Behaviors. This article describes women who touch men when they first meet have a higher incidence of courtship. When a man may ask the woman to go out with them or get their phone number in a positive manner. And when there was no touch involved between the man and the woman, there was less incidence of courtship. So I would see this as adherence to man's request to the woman. Another article that was published in 2013, it's called Handshaking and Compliance with a Request, a door-to-door setting. And this article describes people who go door to door asking for a donation for a humanitarian organization. And what they would do is go and randomly knock on doors and shake the person's hand, and then request if they would give a donation. And people who gave the handshake, about 95% of the people that shook hands with them gave a donation. And people they encountered that they did not engage in a handshake with, only about 53% made a donation. So this goes to show that the power of touch does have positive outcomes socially, monetarily, and medically.